Okay, over to you, Matthew.
Thank you. Hey everybody, my name's Matt. I'm a speech pathologist. I work for Better Rehab, who are an NDIS company providing allied health. I have a bit of a background working with MND. I've been working with MND for about 7 years now as a speech pathologist, and it's, I guess, an area of particular clinical interest for me. And I was hoping to, chat with you guys today about communication from an MND perspective. Communication within the scope of MND is something that is managed quite differently to many other, neurological conditions. And as such, it's not always something that is super well known, or we often get, therapists who, if they aren't familiar with MND, might not be as familiar with some of the management strategies for working specifically around communication in the MND scope. Within MND, there's obviously a great deal of variability, and that in itself can create some really significant challenges with how we look at potential progression of changes in speech, and also about how we manage those changes. There's lots of different things that we're considering when we look at how we manage a person's communication. It's not just about how clear your speech is, but we're also looking at things like how you mobilize, whether you're in a wheelchair, whether you're independently mobile, do you have a wheelie walker, what's your hand function look like? It all seems really unusual to have to think about those things, but when we get further down the track and we're looking at assistive technology, that becomes really important. And so your speech pathologist will probably be working quite closely throughout this process with your occupational therapist. There's a lot of overlap there between speech and OT when it comes to, managing communication effectively in MND. What I'm going to have a look at today is we're going to sort of step through, some of the sort of processes or the clinical information that you might get at the different stages of speech deterioration. So there's obviously, in many people, stages where there's very little speech disturbance, and that can then slowly progress or quickly progress. It's very difficult to say. So starting with really early on, people may be noticing that their speech is a little bit slurred, or that their voice is not as strong anymore, and that they have trouble getting, their voice louder. Your voice might become a little bit breathy or hoarse, and that can have an impact not so much on people understanding, but usually more around the amount of effort that you're having to put in to make sure people do understand. So often in those phases, people find they can be understood, but it requires a lot more effort and sort of concentration to be able to be understood. And that in itself can be quite challenging, very fatiguing, and very frustrating when you note that those communication changes are starting. Something that I hear people refer to really commonly is that they will say that their tongue feels fat or fuzzy when they're starting to notice some communication changes. And that comes primarily from the change in, nerve function within the tongue. So from a speech perspective, one of the main impacts to the communication for people with MND is around tongue function. It's as the tongue slowly starts to get weaker. We use our tongue extensively through speech. It essentially shapes the way the air escapes our mouth, and that's how we create various different speech sounds. If you think about where your tongue is when you make a T sound, that with the tip of your tongue up behind your teeth, those sorts of movements that require really targeted change in movement of the tongue start to become more challenging as the tongue gets weaker. The tongue is an exceptionally strong muscle, but it only takes a very slight change in its muscle strength to affect the way it operates. The tongue in general during speech only uses about 20 to 30% of its actual strength, but it's the speed and coordination of the tongue that needs to be operating sort of perfectly for you to get that speech out clearly. So what we will sometimes do in those very, very early stages, prior to implementing any sort of assistive technology, is to talk about the strategies we can use to help you keep your speech clearer for longer. Speech is always going to be, I guess, the easiest option while it exists as an option in terms of communication. It's much quicker than writing, and it's certainly much quicker than sort of typing or using communication aids. And we generally find that for anybody who still has some functional speech, their preference is usually to use that to communicate. So what we're trying to do is preserve that for as long as possible. So for some people with MND, that can be a long time that we can preserve that for. The speech can sometimes continue right into the late stages of the journey with MND. But for other people who have those, what are referred to as bulbar symptoms, that speech change may have been the first symptom of the MND, and it's potentially something that might change quite rapidly and might change very early on in the journey with MND. So it's really hard to sort of, I guess, judge that. But sometimes your neurologist can help in terms of telling you about what sorts of symptoms you're experiencing and where your first symptoms were as to how much your speech is going to change. Some of the strategies. So the biggest one is to slow down. When you think about how quickly our tongue moves in speech, it's really fascinating actually to see how quickly and coordinated the tongue has to move. As muscles get weaker, it gets harder for us to maintain that pace. The same thing goes, I guess, if we use an analogy a little bit like walking and running. As you get muscle weakness in your legs, running becomes much harder than walking does. The same thing goes for speech. If you can slow your speech down, it gives your tongue a little bit of extra time to get to where it needs to go to make those speech sounds as clear as possible. So one of the biggest things is slowing down the rate of speech. Now, it doesn't need to be super slow, okay? I'm in Queensland, so we all speak slowly anyway, according to Southerners. But it's about slowing it down and overemphasizing your sounds, okay? I guess even comparing how I was talking at the start to how I'm talking now, this rate of speech is sometimes all it takes to make your speech that little bit clearer. So that's the first thing, slow down. Break long words up, okay? I think the best example I use of this is caterpillar. Again, Australians are the worst for this. We just jumble everything into one big mess of a word. We don't clearly articulate sounds in long words. But the more you slow it down, the clearer it becomes. This doesn't have to be really, really slow, but say using the word caterpillar, instead of the rate that I just said it, it's caterpillar. So it still sounds like the same word. It's a little bit slower, but it's a lot clearer. And it's about maintaining that clarity so that the person who's listening can hear what you're trying to say. The next step is to overemphasize your sounds. Now, this one, everybody always says this feels ridiculous. It feels like I'm speaking in some weird way. It generally feels that way for the person, but for the person listening, rarely does it look strange or unusual. It really just helps emphasize the clarity of the speech and getting that tongue to hit those points in the mouth where it really needs to. So overemphasizing and slowing down your speech, two really big strategies. Some other ones we use are more about the environment that you're in, face to face with the person, okay? If you're trying to talk to somebody who's in the kitchen making a cup of tea and you're in the lounge room, it is going to be a lot harder for that person to be able to understand. Communication is more than just speech. It's body language, it's facial expression, it's gesture. It's all of those things, and we pull them all together. And while all of us here might comfortably say, I'm not a lip reader, it's amazing how much being able to see a person's mouth when they speak helps how clear it is. As soon as I cover my mouth, it becomes a lot harder to follow what people are saying to you. So you want to be face to face with the person. The next one kind of sounds like common sense, but you'd be amazed how often I walk into houses and see this happening. reduce the background noise. So we walk in and the dogs are barking, dishwasher's on, the midday news is on the TV, or the radio's going somewhere else. All of those noises are going to be competing for you trying to speak over the top of it. Hit mute on the TV. Move away from the dishwasher. Try and be in a quiet space so that the person who is communicating with you has the best opportunity to hear what you say. That's going to reduce the amount of effort that you have to put into that and reduce the frustration on everybody's part. For you guys as trying to communicate with that person, and for the person listening to you. It's really, there's a lot of frustrations that come from communication breakdown. So there's lots of things like that. Sometimes it's just as easy as, I guess, outlining what you're talking about. So, sorry, I got a bit of lag on my internet there. All right. So sometimes it's about setting the scene. So if a person has no idea what you're talking about, it will be a lot harder for them to interpret what you're saying. And if there are words that come out less clear, they'll be less likely to guess what they are if they don't know the topic of conversation. So sometimes it's just about letting that person know, I'm talking about that trip to the shops yesterday, or I'm talking about my doctor's appointment with the neurologist last week. Set the scene. It's amazing how knowing what the topic of conversation is helps a person to understand some of those less clear words. So there, I guess, some of the basic strategies that you can implement early on to help with communication. Okay, so that's when speech is still going well or better, and you're still speaking mostly verbally. When that starts to change, you might notice that it's getting harder and harder to communicate, to get loud enough to be heard. There are voice amplifiers that we sometimes look at. Voice amplifiers can help project your voice. They're very simple systems. They're just a small portable speaker that you can hang around your neck, you can clip to your belt, you can hang over your wheelie walker or over the armrest of your wheelchair. And they have a microphone. So that microphone might be a headset, a little bit like yours, Peter. Or it could be a little lapel mic, so that clips to your collar, like you see reporters using. There's also some other microphones out there that can help. So if you, for instance, have to wear a BiPAP machine and you have trouble being heard through the face mask, there are some microphones that actually sit around your neck and they press in on the side of your voice box and can amplify your voice without having to have a microphone in front of your mouth. So sometimes that can help in terms of getting yourself louder and continuing verbal communication. Voice amplifiers range in price. You can pick up some pretty cheap ones online for about $100, but some of the higher quality ones top out at about the $400 mark, including microphones. For those who are on the NDIS, that's something that can be looked at being funded through there. But also for anybody who is eligible for the medical aid subsidy scheme, is voice amplification. There is a subsidy available through MAS for voice amplification as well, but you'll need a speech pathologist to help you apply for it. So that's step 2, voice amplification. From there, when voice amplification is no longer working and you're having trouble getting your message out, speech is very fatiguing and you may only be able to get out one word at a time, there are other options. We call them speech generating devices, and this is when some of the space age tech starts to step in. I guess the most well-known speech generating device user would have been Stephen Hawking and the use of his computerized voice. So speech generating devices are generally some sort of electronic device that will create speech for you. So for people with MND, we know that you guys in that population cognition remains intact. And so we can use speech, text to speech systems. This is where you type into it, and it will speak whatever it is that you've typed in. So I guess one of the earliest ways to access this technology, and everybody has them these days, is a smartphone. Okay, there are apps that you can get for your smartphone that you can use. You can use predictive text if you're that way inclined. I know that frustrates some users as well. When the phone decides what it thinks you're trying to say, and it's not in fact what you were. But they start with I guess very basic apps on those sorts of things. And this is where the OT side of things comes in. This is where I'm looking at your hand function and how you get around. This is where all of those considerations need to be taken on board, because I guess some of these devices can get very large and very heavy, and it's working out how we use those in everyday life. Whatever system is put in place needs to be usable across a whole range of environments. Communication is dynamic, it happens everywhere. And I guess it's important to point out that some of these high-tech devices, they won't work in every environment that you need communication in. For example, I think most people would have worked out by now that computers cannot go in the shower. They can't go to the beach. You know, there's various different places. They can't go out in the rain. Okay, there's lots of different places where high-tech systems are not ideal. Just because a computer doesn't go there doesn't mean that there's no need to communicate in that environment. And so we have to consider multiple different options. And I guess communication is more like looking at this as a toolbox. We give you a toolbox of different tools so that you can use them in various different locations and various different situations. So from a speech generating perspective, we start at the very simple, we call them light technology options. These are not given to people because we think that you're incapable of operating technology. These are given to people because everybody knows that technology doesn't work when you really need it to. You know, your mobile phone is always flat at that pivotal moment when you need to use it. You go to grab your iPad and it's not working, or it's decided that it needs to update and it's going to take 25 minutes for the update to load. Sometimes what we need to say is time sensitive and can't wait for these things to just do their stuff in the background. So we have what we call light technology options. These are alphabet boards, picture boards, laminated pieces of paper that can go anywhere with us. This is the stuff that we can use in the shower at the beach. It doesn't matter if our laminated piece of paper gets wet. And if we ruin it, it was a piece of laminated paper. It's 50 cents to replace as opposed to 20,000. So we look at these systems and we look at how we use them. So generally these systems for somebody with MND are very reliant on the person that we're talking to operate them. People will pick up the page and point to the various different lines and work out what it is you're trying to say by spelling out words one letter at a time. It's slow. For someone who doesn't know how to use it, it can be quite tricky. And the listener has to concentrate very carefully, just as the person with MND would as well, to make sure that they're getting the message correct. But in the absence of all other communication, this is still a really good way to get our message across. I'll give an example of a situation I heard recently. Was a gentleman with MND. He had some respiratory involvement. He used a BiPAP fairly regularly. He had a high-tech communication device and he had a fall in the bathroom and got wedged between the toilet and the wall. His wife came in and he was trying to say something that she could not get. She thought he'd hurt himself. She could not work it out. And she pulled out this paper-based communication board and was able to spell out with that BiPAP. This man didn't care that he was on the floor. He was not hurt, but he could not breathe. And that was a medical emergency in which his eye gaze device was not was not suitable. He couldn't use it whilst lying on the floor waiting for the ambulance to arrive. But by getting out those 5 letters on that alphabet board to his wife, she was able to go off and get his BiPAP machine, plug it in the bathroom, and put it on him while they waited for paramedics to arrive to get him up off the floor. And that probably saved his life that day. So I guess what I want to try and really, reinforce is that the light technology options are no less important than the fancy bells and whistles, high-tech communication devices. Please don't ever feel like your speech pathologist is, judging your ability to use technology when they introduce these tools. It's not about your ability to use the tech, but it's about when the tech is suitable to be used. Following on from that, we've got high-tech communication devices. These are the sorts of things that you see online. Because of deteriorating physical function in MND, often a lot of people start to find it very difficult to use their hands to type or to use a touch screen and things like that. And that's when the phone or the iPad with the app might be becoming more difficult. And so we're looking at making sure that whatever system we have can be accessed. So we refer to it as alternative access. And again, this is where our OTs become really, really helpful here in helping us set this up. We look at the communication device and the software on it, but it's with our OTs that we look at what an appropriate access method is. This might be eye gaze, so using your eyes to control the screen. So eye gaze cameras use reflected light that throws into your eye, and the light comes back to the camera, and it allows the camera to work out where you're looking at on the screen. This is probably one of those, what we refer to as space age technologies, but was actually, has been around for 25, 30 years now. It's just that now it's far more affordable and accessible to the general population than it was. This stuff is used quite frequently for clients with MND because we know that the eye muscle movement is one of the few muscles that doesn't get affected by the disease progression. So we refer to this as being something that's quite future-proof in the fact that we know that that eye movement will be maintained regardless of the disease progression. And it will mean that we're giving you an access option that will maintain your ability to communicate regardless of physical function. We can add lots of different systems to eye gaze devices. We refer to them as switches. And for those of you who use computers regularly, it's a little bit like clicking the left click on your mouse. A switch sends a message to the computer that tells the computer you want to click on that. Switches aren't always, a mouse is a type of switch, but we have lots of different ones that we use for people who have, physical limitations in the way that they can activate that. So using your hand on a mouse on the desk, it requires a lot of upper limb control, shoulder strength, upper body control, trunk support so that you can sit up and look at the computer screen. All of those things that we don't really necessarily think about, but from an MND perspective might not be present. So switches can be lots of different things. I know in the MND world, lots of people have heard of a thing called the Neuro Node. And the Neuro Node is a type of switch that uses electrical muscle activity to send that click message to the computer. We can get switches that look like a little piece of string that we hook around somebody's finger, and it only takes a slight movement to activate. There's lots of different ways we can activate that switch message and help you sort of access a communication device. It sounds really complicated, from this perspective when it's not there to demonstrate, but your speech pathologist and OT can work with you to trial these things. And I guess the most important thing is to not be scared of the technology. Have a try of it. It's not for everybody, but some people love it. And even if you weren't a big technology user prior to your diagnosis, sometimes you will find that the benefit that it brings is enough that you will persevere with the technology. So even if your therapist is suggesting it, it's really more about trialing this stuff. Sometimes you might feel like your therapist feels like they're pushing it on you. essentially in that situation, it's to make sure you're being really open and honest with your therapist about how you're feeling. Sometimes we come out and get a little bit over enthusiastic with this stuff. Most speech therapists are pretty passionate about communication and assisting people to communicate. And for the person that we're working with, sometimes that can be a little bit overwhelming. Some of the technologies that we introduce in some of these sessions can sometimes really drive home some really strong feelings about what's happening and, you know, that course of disease progression in MND. And it's perfectly understandable that in some situations, this process will bring out some really strong feelings. And I guess the thing I really wanted to emphasize here is to make sure that you're telling your therapist how you're feeling about all of this, rather than waiting for them to leave and putting this stuff in the cupboard for 2 weeks until they come back, is to tell them about this stuff so they can work with you to find a way that works for you. As speech pathologists, we're there to assist you with your goals and what you want to achieve in terms of your communication. I know sometimes it feels like we're driving that in that point in time, and some clients like that and some clients don't. We will never be offended if you put your hand up and go, whoa, Matt, this is way too fast. I'm not ready for this. I can't handle looking at this eye gaze stuff. I'm not at that point of acceptance yet. I'm not at that point of understanding. I can't see how this is going to be relevant to me. I've still got good hand function. I want to keep using my iPad. That's fine. Be really upfront. Tell us what you're feeling, what you're thinking, and we will try and work out a plan that works for how you are feeling at that point in time in conjunction with your level of function. I can't emphasize that enough. Otherwise, it's a waste of your time. If we're there pointing out stuff that you don't want to use, we're wasting your time. And we don't want to do that. Time is precious, as everybody with MND knows. And we want to make sure that the input that we give is relevant and useful to you at that point in time. So that's communication devices. The one last thing I wanted to chat about is what we refer to as voice banking and message banking. Voice banking is a process that has been around for quite some time, but has become, I guess, a lot more accessible and a lot more popular in recent years, particularly for clients with MND. Voice banking and message banking are terms that people often hear, and many feel that this is an interchangeable term. It's not. So what I'm going to go through today is just a brief description of what the two are and what it can do for you. So I'll start with message banking. Message banking is the process of recording personalized messages that are, I guess, characteristic to you as a person, that people maybe associate with your character and you as a person. So if there's sayings that you say regularly or that you say in a particular way, these are the things that can be recorded. We record them exactly as you say them, and this process generally takes place prior to the deterioration of your speech. Message bank systems then get put onto communication devices, so those speech generating devices we were talking about. And what this allows is the preservation of your voice. Now, for some people, this is not a big thing, but for others, it really is a huge thing. Our voice is part of our identity. It's part of who we are. It's part of how we see ourselves. And I guess you think about the fact that how much changing your voice can change a situation, or how much your voice links you to who you are. For example, if I pick up the phone and I call somebody that I know quite well, I can say, oh, hi, it's just me. And based on the sound of my voice, that person is able to identify me. It's huge. And sometimes it's not until we lose that part of our identity that we realize how much we related to it. There's a lot of things that occur in MND that we can't control. There's a lot of there's a lot of functions and parts of a person that are lost during the MND process. It's a horrible, horrible process. For some people, the ability to preserve their voice, and as part of that, their identity, is something that we can preserve at this point in time. There's lots of things that we can't preserve around physical function and independence, but there is this thing that we can preserve these days, and it is our voice. So message banking is around recording those key messages. So, for example, if you have a particularly beloved pet, okay, it's about, you could record that pet's name so you can call them over using your communication device. I don't know about you guys, but I know my dogs listen to me, but not to my family. That comes back to that voice and that identity. So if you want to call your dog over and it doesn't sound like you, they're less likely to come. If you've got kids or grandkids, okay, and you say, or you've got, nicknames for people in the family, or just phrases that you would say every day to your family, your loved ones, it's recording those messages so that they're available to you on your communication device. And you hear a lot of this from carers who say the communication device is great, but it doesn't feel like I'm talking to Bob because it sounds like a computerized voice. Having that voice is sometimes not even just important for our own identity, but how our family and our loved ones perceive us, and how they interact with us. And while most of our families would never say it to someone with MND, as they sit back and watch this process go through with their loved ones, it's another part, I guess, of the process for them is around some of that preservation too. So that's message banking. You record the messages and they're played back exactly as you recorded them through the system. Then there's what we call voice banking. Voice banking is where you record a whole lot of nonsense sentences and your speech is broken up and recreated into what's called a synthesized voice. I think one of the best known synthesized voices in the world these days is Siri, the Apple voice. But there's also voices, there's synthesized voices in lots of things. Anyone who's used a sat nav, anyone who's had talking software on their computer, all of those digitized voices that we have are what we call a synthesized voice. They're made by recording a range of different sentences that contain every different sound in the English language. Then they chop those sentences up into individual sounds so that when a word is typed into the computer, the software can go, okay, that word contains those 5 sounds. I will pull them out and put them together, and that will create this digitized voice. When you've done voice banking, the digitized voice will not sound exactly like you, but it will contain characteristics and tone that is, characteristic of your voice. And that's something that a lot of people don't realize when they go through voice banking, is that the end voice is not going to sound exactly like you. It will sound similar to you and it will have characteristics of your voice. With voice banking, it doesn't always necessarily have to be the person with MND that does the voice banking. I have a client here in Queensland who his speech has already started to deteriorate and he's unfortunately missed the window to do voice banking. But he and his brother sound exactly the same, to the point that his mother could never tell them apart on the phone. So his brother has stepped in and has now started the voice banking process so that the voice that will be on his communication device sounds like his brother, which in turn sounds like him. There might be a family member. We have another client who, again, has missed that window for voice banking, but rather than sounding like some off-the-shelf computerized voice, has indicated that she would rather that her daughter voice bank for her and have her daughter's voice on her device. At least it's a familiar voice and somebody that she knows and can relate to. So there's lots of different ways voice banking can be done if we're at a point where it can't be your own voice. There's lots of ways that those two voice banking and message banking systems double up. It's a little bit complex, but I guess if you do message banking and you do enough messages, sometimes you can use those recordings to have a voice-banked voice made, and you get the two processes out of one set of recordings. But there are some very specific guidelines that need to be followed for those sorts of things to happen. So it's really important, again, that you chat to your speech pathologist. These sorts of processes are why you may find that your support coordinator or whoever's, I guess, supporting you through the MND process might say, I want to get a speech pathologist out to see you. And you might be sitting there going, what the hell for? My speech is fine at the moment. I don't need a speech pathologist. Some of these processes that we talk about in terms of voice banking, it's really important that that's done before your speech deteriorates. When it comes to communication devices, depending on what funding program you're relying on, some communication device trials and scripting periods can take 3 to 6 months. So it's sometimes the case that while it's hard to see the need for it early on, there is often a need from a preparation perspective to start these processes earlier than you may think necessary. The last thing we want to do is wait until your voice is not functional to start the process, because by the time the process is complete, it may have been 3 or 4 months that you've been without a method to communicate. And that's a really, I guess, a really dangerous situation to be in, particularly when there's so much happening, so many decisions being made, and so, I guess, so much interaction with health professionals and family as you go through the process. And so that's why often, not just speech pathologists, I know OTs do the same thing. You know, we get in early so that we're prepared. What we hope for when we get in early is that we've wasted your time. We would love that the stuff that we're doing with you to not be needed. And in some cases, it might not be needed. But we would rather have it there ready than to not prepare for it and not have it when we need it. So I guess think about those early sessions as, my goal is to waste your time. I would love nothing more than for the communication device that we may have gone through the process of scripting. I'd love nothing more than for that to stay in the bottom drawer and never be used throughout the whole disease progression. That would be, I guess, the best outcome from a bad situation. But what we don't want is to not be able to communicate at all. So on that note, that's kind of that's a snapshot of communication. That's a lot of information crammed into about 40 minutes. And it is a very brief overview of, I guess, what a speech pathologist can do for you in terms of communication. I guess my goal here is for you guys to be aware of what's out there and what we can support you with. And so that you know what you can ask about, or, you know, if you haven't engaged with a speech pathologist and you've heard something today that you thought, you know what, that might be useful, it gives you that power to turn around and seek out that advice, to get that information from a speech pathology service local to you. So on that, are there any questions?
Okay, so just before I unmute everyone, can everyone hear me? Yeah, excellent. Look, I just wanted to say a massive thank you, Matt. That was extremely informative, and we at MND Queensland are really grateful to you and Better Rehab for generously donating your time for the benefit of people with MND. We've been talking with management of Better Rehab for some weeks now, and they've definitely demonstrated a commitment, and that's really useful to everyone. So yeah, really, really grateful. So let's make the most of having you available to us for a little bit longer, and see what questions we've got for you. So everyone should be unmuted unless they've muted themselves. So over to you. Anyone want to ask anything? Kay, did you have a question?
No, thank you.
Okay. Anyone else have any questions?
Yes.
Maureen, yep, excellent.
Yes. I'm just wondering, my voice is already affected. Would it be useful to voice bank with his affected voice?
Yeah, so the voice banked voice that you do, there is quite a bit of software in there where they can touch up some of the less precise sounds. I've certainly never done it at a point where the voice is too affected, but I did recently go to a workshop run by a gentleman by the name of John Costello. He's a speech pathologist in Boston, and he's the guy who basically created message banking and got this all happening. His comment actually was, if you've still got speech, it's not too late. The voice certainly won't be quite as clear, but the software in the process can help tighten some of that up. So it's, I guess, more about whether you'd like to spend the time and to go through that process. But, you know, I guess listening to you, Maureen, I was still able to understand what you were saying via a computer link. That in itself says a lot about, I guess, the fact that you do still have some functional speech there. And so it would be quite a tiring process for you, but wouldn't necessarily be a waste of time. You could, I guess, have some of that, just thinking about the fact that the message, the voice that you bank will be the voice that you have at the moment. It won't necessarily sound like, you know, past days Maureen, but it will be, I guess, a capture of you as you are now. So it's definitely something you could try. Some of the voice banking programs do actually give you the opportunity to do the recordings and then play back a sample of the voice before you have to purchase anything. So I guess that's the other thing, is that voice banking, the whole process of it, there's a lot of it that can be done for very little cost. You don't actually have to purchase the voice then and there. You can do all the recordings and then purchase the voice down the track when you need it. Or if you do the voice banking and you think, do you know what, I don't like that voice, I'd rather just go with the version of Queen Elizabeth that's on my communication device. You can do that as well. Queen Elizabeth II is a voice option in the Grid 3, which is one of the communication softwares that we use on devices.
Thank you. Thanks.
Any other questions? Peter?
As Tony Jones says, it's more a comment rather than a question. That was a great presentation, Matt. Thank you very much. It made me aware of what a few things I already knew, but I think the important thing of your talk was how you linked it to MND. And it's great to see your understanding of the disease progress and how that impacts the choice. So that was very helpful to me. And believe it or not, speech pathologist is in my near future. So thank you.
I'm glad I could get that message across, because I think that's one of the real challenges that we as clinicians face, is that MND is quite a different disease process. And in many disease processes, it's about rehabbing the loss of function. But unfortunately in MND, that's not an appropriate approach. And so we get a lot of therapists who, if they're not quite as familiar with MND, you know, really struggle to sometimes manage some of those situations, or unless you've seen a lot of it, really understanding what the person is feeling. I can never say that I'll understand truly what a person with MND is going through, but having been working in the population for 7 years, I can work off, I guess, a whole bank of the feelings that I've seen with my clients and help apply that, I guess, common themes to people with that disease. And so it was a steep learning curve to be able to get to that point where I can link that back. But it's really about being open with your therapist, so that if they're not aware, I guess that's almost like a teachable moment in itself. As therapists, we don't know everything. So please make sure you do let us know all of those sorts of things. If you think that the approach is not what you need, is to tell us how we can change our approach to better meet your needs.
Any other questions?
No, I found it very informative. It was great.
Thanks.
It gives me a lot of much more knowledge on it.
Great. Andrew, did you have a question you wanted to ask?
Do palatal lift devices have any role?
Sorry, just repeat that one for me.
Do palatal lift devices have any role?
The palatal lifts, it really depends on what the thing you're experiencing is. If you do have palatal insufficiency, as they call it, palatal lifts can help with nasal emission. But a lot of the change in function that we see, and sometimes a lot of the struggle, actually comes from tongue function and voice function more so than palatal function, I guess. Palatal lift would help one component of the speech. And so it's very, very dependent on a person. There's a lot of people who can't tolerate palatal lifts depending on your gag reflex. But you know, it would be something you could explore. So a palatal lift needs to be made by a dental technician in order to get that in place. But I guess the majority of the speech impairment generally comes probably more from tongue and voice than it does from palatal insufficiency. Did that answer the question?
Yes, I can understand why it may not suit most people. I mean, I used one when I was still working.
Yeah.
But I was never quite sure whether any improvement was just my thinking there was rather than really being an improvement.
Look, in the early stages of speech change, it could well have made an improvement and help prolong your speech for that little bit longer. Excess nasal emission during speech can actually make it quite difficult to understand what a person is saying because it changes the resonance of what we're saying and can really change some of the speech sounds. So if that was an early symptom, it is quite likely that that could have had a symptomatic improvement in those early stages of the change. Yeah.
Excellent. Okay, any other questions? No? All right, well, we will wrap up there then if there's no last questions that we want to ask Matt. So thank you again. Just for the rest of you, then we will continue our support groups, our online support groups at 11 AM every Thursday. So next week is just a general support group for everyone to just come along and have a chat about whatever it is that they want to talk about. And then on the 9th of July, we will have our very own Sandy Biffin presenting, our MND advisor, presenting on making yourself heard. And that's really around what Matt was talking about there, about making sure that your health professionals hear what you need. So rather than them providing solutions based on what it is that they think is the best thing for you, that you make your voice heard, your needs heard to them. So we're looking forward to Sandy presenting to on that 11 AM on the 9th of July. So thanks again, everyone, for coming. It's nice to see all your faces, and I look forward to seeing you again in the future.
Thanks, Matt.
Bye.
Thank you. Thanks, Matt.
Bye.
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 Thank